come out for a walk today because Boopington Farm is a bit cold and wet. I've got the squeaky dog with me. She is being extra squeaky. Say hi, Boo Boo. This week at Boopington Farm, we are going to talk about complex post-traumatic stress disorder, which is a deeply personal topic to me because I have CPTSD. Where do I begin to explain what it is? Okay, so CPTSD is something that happens over a really, really long period of time. Repeated experiences that happen again and again and again get compounded into post-traumatic stress disorder, and it becomes CPTSD. Now, some people call it childhood PTSD, which is that's not accurate, because the actual having PTSD can come from anything that happens over and over again. It doesn't get limited to childhood. You can get it if you're an adult in an adult relationship and you have domestic abuse happening, and it happens over a really long period of time, and that means you can get complex post-traumatic stress disorder. It's not limited to being in childhood. Having CPTSD is different to having PTSD in that post-traumatic stress disorder can happen from a single event. So you could be involved in a car accident. Somebody might go into the back of you, you get whiplash, and because of that, whenever you go past that specific place again, you have uncontrolled anxiety, or you have different feelings or emotions that come out, and you might have physical reactions, you might have shakes, you might have shivers, you might have uncontrolled thoughts, you might not be able to be in that place, you might get angry, you might get sad, you might get feel depressed, you might shut down, you might become hyperactive or hypervigilant to danger. These are all symptoms of PTSD. There are also symptoms of complex PTSD. PTSD is mostly easier to treat. Complex post-traumatic stress disorder is more, in its name, complex. So it's more difficult. A lot of people that have CPTSD, it does come from their childhood, and this is where mine comes from. Now, I'm not going to go into details of my childhood. What I only self-disclose that I have CPTSD and how I manage it. It is really difficult sometimes. Occasionally I have days where I do not like going outside, I do not like talking to people, I don't like being in certain places. I'm really happy right now being out in the woods. Even Boo Boo is enjoying it now. She's got over her anxiety. She has PTSD as a doggy. She was attacked when she was 7 months old, and then when we were living in temporary accommodation, she was attacked again, and that was not pleasant. She's starting to decompress and get over it, which is indicative also of my journey. So I'm getting over my traumatic past, and I'm dealing with it by going through a process called individuation that Carl Jung describes as bringing together, careful of the mud, bringing together all of the different parts and archetypes that you embody as a human being. And the most predominant one that I've done is shadow work. Shadow work is really, really beneficial for people who have CPTSD, because there's a lot of things that we don't necessarily want to look at, because looking at it means accepting what was done to us, and accepting what was done to us is a deeply painful experience. It's easier for us to say, this thing didn't happen to me, those experiences didn't happen, and bury them when it's too painful to process. And that's what many of us do. We bury them, and then we end up with symptoms. Now, those symptoms could be getting tremors, getting shakes, and there's no danger, boo-boo, there's nothing. No, there's no danger. Those symptoms could be, yeah, I'm coming. Those symptoms could be shakes, cold sweats, getting uncontrolled anxiety, uncontrollable fear. Your body might go into fight, flight, freeze, fawn, or flop. If you're around people that remind you of, let's say, the people that caused you harm over those repeated, what they call is adverse childhood experiences, ACEs. So if they do have childhood trauma and you've had a lot of those ACEs experiences, that if you're around someone that reminds you of the person that did those things, then that might trigger your body. So you might find that all of a sudden, so if you talk about fight or flight, you get really angry, you have thoughts about hurting someone, or you have thoughts about getting away from this person. So there's a fight or flight. You want to run away and hide, you want to disappear, you want to vanish, you want to like I have to get away from this person. People might like feel really jittery, feel really like, I've got to run, I've got to get out of here, I'm not safe. They might vocalize this as well. It's quite common for people to have verbal and non-verbal tics in their responses. That's something that I had for a really long time. I still occasionally do experience these if I'm not regulating myself, or if I've dysregulated. So for some reason my body and my mind has been triggered by something, and I need to and I've been sent back in time. That's quite common. Your body will get triggered before your mind catches up. So you might find that fight and flight are the first ones that pop up, and then I find that freeze is next. So you get rooted to the spot and you get stuck. You can't go anywhere. This is also where you might shut down verbally and mentally, so your cognitive processes shut down and you go silent and you stop moving, you end up being very still, you make yourself very small, you don't want to. What your body's doing is it's trying to protect you by making you invisible to the thing that it perceives as the threat, except sometimes this is an unfounded threat. So baby's seen a squirrel, so now she's pulling me along. If your body or your mind perceives a threat, even if it's not a threat, it could be that, like for my dog right now, she's seen something that has triggered her. This has triggered her prey instinct, but she's also trying to protect me. She is essentially guarding me, but she also suffers from something called resource guarding. So she's resource guarding me as her human, as her resource. She's protecting me, she's doing her job because she is a guard dog, and she's trained to be a personal protection dog now. So if anyone comes near me who is a threat, then she will defend me. So your body might perceive something that it sees. It could be a tree, it could be a smell, it could be someone touching your hand in a certain way. It could be the smell of perfume. It could be the smell of aftershave. It could be temperature. It could be that you get into a bath that's too hot. Before I understood what that feeling was, if I got into a bath that was too hot, I used to be so frightened, and I had no idea why. Honestly, like no idea why I was being triggered, why I was scared, and it was because I was put into a hot bath as a child, and I was told to get in the bath, and then I was threatened if I didn't get in the bath. So, as a child, toddler, I would get into a bath that was way too hot for me as a child or baby. Triggers can come from anywhere, and they can pop up in the most weirdest ways sometimes. And I say weird because it's like, I get triggered or was triggered by the bath. I've experienced triggers like temperature. I've definitely experienced, my throat's going. I've got a bit of a cold today. My completely lost track of what I was going for then. Perfume or aftershave is one that has most definitely triggered me in the past. Being around someone that hugs in a certain way, or somebody that attempts to hug you that you don't want to hug, that can be triggering. So if you're experiencing any of these things, don't feel ashamed, because we all experience triggers and we all experience life and existence in different ways. And if you get triggered by something like touch, or by smell or temperature or a place, or you go past a road sign and you look at the road sign and the shape of the road sign makes you think about something, or don't feel ashamed of what you're going through. What you're going through is valid. It's your unconscious trying to tell you something. Oh, definitely not a nice cold. Listening to your unconscious is really, really important. It's trying to tell you things, and it's trying to tell you what is hurting you while also trying to protect you. I know, but it's getting a bit wet now. This is why trauma-informed therapy is essential for people with CPTSD. It's a blended approach, so it uses lots of different types. It will use the top three, as I call them, the top three. So top 3 schools of psycho blah, blah, blah. Top 3 schools of therapy are humanistic, psychodynamics, and cognitive behavioural therapy. They're the ones that I use the most. Now I am studying them the most, and I haven't studied many of the others. As part of my training to become a fully qualified psychotherapist, I will be. For now, these are my kind of go-to 3 as to the level of where I've got to in my training. They're really beneficial for people with complex post-traumatic stress disorder and post-traumatic stress disorder. So they're good for CPTSD and PTSD. I found that I found it really helpful having a blended approach of the 3, because before trauma-informed therapy, I had never experienced what's called unconditional positive regard, where I was accepted for who I was. So, I'm a queer person. Being out in life is difficult because people still think queer people shouldn't exist, and really and truly I don't understand that, because people are all different. We're all made up of different hominid species. We've been recorded in history for thousands and thousands of years, but according to current belief, like trans people haven't existed since the 1960s, which honestly just does not make sense. So I stick to those 3 schools for therapy. They're really good. They give such a strong base, so you can mix unconditional positive regard, help somebody calm their body, help somebody calm down and learn to relax. And then once they've relaxed enough, you can use psychodynamics to do a little digging into their past, get a little bit of information. Then you can use cognitive behavioural therapy to start challenging their beliefs in the present, start managing those symptoms, then go back to psychodynamics and start doing a deeper problem root cause analysis for where things come from. And you can really, really start to help a client open up. So, back to fight, flight, freeze, fawn, and flop. So we got to freeze, and a person gets stuck and they get rooted to the spot. And this might end up with you being in a situation where it is still really dangerous for you, but because you're stuck in freeze, you go still and you hope the danger goes away, which is really, really a horrible experience to be in, and it feels very, very painful because you end up being in a situation where you're stuck with the potential danger that is about to hurt you, and that danger then doesn't go away, and you end up being surrounded by their danger or oppressed by their danger. That is deeply horrifying for some people, especially if they experience it and they get stuck in freeze when they're with potentially the person that is going to hurt them or is hurting them, and the body just shuts down. This is where people also experience dissociation from their body. Fawn. When you go into fawn, you might experience a very strange scenario. Strange in the sense that somebody who's trying to hurt you might become your best friend. Somebody who makes you afraid of them uses intimidation, uses their physical presence, uses their size against you, pushes you around. They might be emotionally controlling, they might be physically controlling, they could be using sexual coercion as well. And your brain goes, okay, this person's hurting me. Now the only way I can survive is if I make them my best friend. And if I do everything I can to make them help me, and I do what they want, and I do it, and I smile, and I say thank you for hurting me, which is, it's bizarre, but yeah, it happens. Trust me, it's a very strange feeling to be in the middle of an experience and still think that someone actually cares for you when clearly they don't. But it does happen, and please don't feel any shame or regret or anything like that if you are in that situation, because it happens to a lot of us. There is sometimes a lack of awareness on our part because we don't know that we're experiencing it, even though we're in that situation. And as Carl Jung said, you have to make the unconscious conscious. Otherwise you'll let it rule your life and you'll call it fate, which is really sad, desperately sad for many of us who have gone through trauma, have healed, and then reflected on where we were to realise what happened to us. There's no way to smooth it over other than you need to get yourself into trauma-informed therapy. It will save your life, it will keep you safe for the future, and it will completely, fundamentally change who you are as a person, which is, again, is individuation. And as a process that you'll go through, I cannot recommend it enough. Bringing together all of your different parts, your shadows, your different archetypes, all the pieces that you were afraid to look at. In trauma-informed therapy, you will be given the safe space to look at all your individual parts, and you will be kept safe by your therapist. For myself, I'm giving helping conversations. I'm not quite qualified as a therapist, but I'm on my way. And once I do, then I'll be able to go deeper into the process. So for now, helping conversations is like life coaching, but because I have completed level 2 counselling skills, it means that I am actually qualified to provide helping conversations and use psychotherapy in there, but only to a certain level. So I can't go into your childhood and look at childhood wounds because I'm not yet equipped to protect myself and a client from uncovering memories or what that could mean for both of us in therapy. So there's an ethical practice to follow and ensure that we, as helper, therapist and client or helpee, are protected within that process. Flop. This one is something that I was essentially taught to do as a child, which it even just thinking about it, thinking that I was taught to go into flop. So when you experience anxiety or something dangerous, your body just decides to completely lose all of its energy, might put you into a cold sweat, might make you smell bad, might make you want to throw up and be sick, and might generate shakes, tremors, tics, all these different types of things. What your body is reacting to is danger that it thinks that it can prevent, which is essentially a big giant grizzly bear that's attacking you. And if you go into flop and play dead, then the big grizzly bear is not going to find you very tasty, and then because you're not very tasty, it won't eat you, and it will go away and it will leave you alone. But when you experience this in a domestic abuse scenario, this can be deadly, because the person harming you knows exactly what they're doing, and when you are experiencing going into flop, they will just stand over you and use it as a way to intimidate you. So if you find that happens to you, and someone isn't helping you, and that you've lost control of your body, and that you are finding yourself being riddled with fear and unable to move, run away, you've gone into freeze and flop, usually they're together, then I highly recommend you go and seek out a trauma-informed therapist.